All right, we're going to go ahead and get started. Welcome to today's webinar. We're really excited to bring this topic to you guys today. We've been doing some research around healthcare and kind of all of the state of change that has been going on in healthcare since before COVID, but then also, post-COVID, and are excited to talk to you today a little bit about some of those changes. Primarily, we're going to hear from Sandra Brown, MDRG's president and founder, and then I'll jump in at the end again. And if there are any questions, more than happy to address them. Please just add them in the questions panel, and we can take care of them at the end. So again, thanks for joining us, and I'll let Sandra take it away.
Good morning. Thank you, Stephanie. Thank you all for being here today. I am very excited to share with you the results of an in-house research study that we've completed, and we completed it with the objective of unpacking what are the opportunities for healthcare and especially hospitals and health systems in a post-COVID world. Now, we primarily wanted to understand how do consumers view some of these industry disruptors compared to traditional healthcare systems in the wake of the pandemic, and more specifically, the role that trust plays in selecting healthcare providers along a broad continuum of care. I want to just give a few details for the research-minded in attendance. The study was conducted nationally among 935 respondents with the sample balanced to the census, with an oversample for Black and Brown consumers that was used in some instances to draw comparisons where applicable. So with that, I want to go ahead and get started on the meat of this presentation. You know, we used to start our presentations related to consumerism in healthcare by saying the healthcare landscape is changing. But I think we all realize now that the tipping point has come and gone for consumerism. It's no longer talking about consumerism coming or the impending changes in how people receive care. That change is already here. Now it's really about adapting. You know, this quote, adaptability is about the powerful difference between adapting to cope and adapting to win. COVID-19 has accelerated the adoption of telehealth, and by that I mean any care that's not received in an office or a face-to-face setting. I mean, I think that's a well-known fact. Even those ahead of the consumerism curve in March were adapting to the sheer volume and fast-paced change in expectations of consumers. And those that emerge, those hospitals and health systems that emerge from this tipping point successfully will do so because of an adapt-to-win mentality. So let's talk about the competition for a minute. Amazon, Apple, Google, all of these tech brands are getting into healthcare. Beyond that, there are individual health tech players like Teladoc and Hims and Hers, and there's a plethora of those types of competitors in the market. You know, Amazon just revealed its latest step into healthcare, a multi-trillion-dollar opportunity that the tech giant has been eyeing for a number of years. They acquired an online pharmacy PillPack, and partnering with JP Chase and Berkshire Hathaway, they founded Haven, a healthcare joint venture. Last year, Amazon Care Virtual Clinic in Seattle launched. That's Amazon's home market. And the company's even developing COVID-19 tests to use on its workforce. And now we see Amazon partnering with Crossover Health, which is a primary care provider, to open clinics for their employees, Amazon's employees, at fulfillment centers across the country. They're calling that the Neighborhood Health Center Pilot Program. You know, and we're seeing retail giants, CVS, and other retail giants, Walmart, continue to grab for a share of this $2.5 trillion industry. Walmart and Walgreens are opening primary care centers. CVS is continuing to add digital therapeutics that its CVS Caremark offers to employer-directed healthcare. You know, and these are just a few of the headlines that we've seen over the course of the past few months. I mean, we could spend a whole presentation talking about what these tech and retail giants are doing in this space. Prior to COVID, we were talking about the fact that consumers expected on-demand services as their experience with Amazon and DoorDash and the Ubers of the world really colored and changed how they interact with brands. And all that has happened with COVID is it has accelerated the technology adoption out of necessity. And even among the older and less technologically sophisticated population groups, we're seeing that adoption, and those of you who are in the hospital health system industry know these numbers through the roof. And we're not going back to where we were pre-COVID. The technology adoption for some of these services pre-COVID was slow. Some of it had really plateaued, and a lot of this, I would suggest, was driven by a lack of integration into workflows and really, a bad or inferior user experience. And it was also more of a direct-to-consumer model. And so what COVID has done and this pandemic has done is it's forced a lot of adoptions, and it's forced that integration into hospital systems and work processes. But I would suggest that the consumer-facing barriers are still there. And so what's going to define success now will be about the user experience. And it's something that our tech and retail competitors have a leg up on. So how can healthcare capitalize on this accelerated pace of adoption that ushered our patients through the digital front door? Let's start looking at some of our data. One of the first things that we looked at in our study was how favorably consumers view the following brands. And for the purposes of this study, we selected Google, Amazon, Microsoft, and Apple to represent the technology sector. And Walgreens, Walmart, CVS, we selected those to represent retail. And we also included Verizon and AT&T because of their integration of the Internet of Things within the home and the looks of that industry, potentially working that into healthcare, specifically around monitoring. So this is kind of a TBD, but we threw it in for good measure. And so in general, in market research, we say a score of 75% and higher on a favorability question is considered very good for a question like this. And so what we see is that Google and Amazon are nearly at that point, with Walmart not far behind. So that's just a starting point in thinking about this. And when we add in one's primary care hospital in this favorability question, we see that there's not a huge difference between the tech brands here. There's 77% favorability rating for your primary care hospital. So we're in this situation where consumer experience and customer experience means everything, and we have these competitors who are about as well liked as we are that have really mastered this user experience game. So what does that mean for our industry, and how do we in healthcare need to respond? And what advantage do we potentially have in this push toward technology adoption? And so that's what we dove into in our research. We had seen a nugget in some of our past trackers. We've had these ongoing trackers since early March. Originally they were weekly. We've switched them now to monthly and eventually quarterly. But what we began to see in those trackers is that there was a nugget that was worth exploring, and that nugget was trust. And so in our trackers going back to March, we began to see both qualitatively and quantitatively that trust in healthcare heroes, in the health system to really adequately treat and handle the COVID-19 crisis was high and remains high. And our premise is that trust is healthcare's new competitive advantage. Pre-COVID, we would have talked about the huge challenge that health systems had in overcoming consumer openness to healthcare solutions from outside of the industry. And, it wasn't even just convenience and ease of use. This is some pre-COVID data of a question that we would ask. And what we saw here is that digital natives, as defined by 18 to 44-year-olds, trusted innovative tech companies to develop the best tool to find and select healthcare services. but so did those over the age of 45 as well. What was interesting, if you look at the digital natives, they trusted Amazon, Apple, and Google twice as much as they trusted the local hospital or health system. And for those over the age of 45, they were really at parity. So trust was what we needed to earn back, along with we need to provide better access, easier access. We need to provide more intuitive interfaces that seamlessly integrate with each other. You know, prior to the pandemic, we were talking about this stat a lot to say, come on guys, we really need to look at these competitors and begin to focus on what they're doing and how we can begin to match some of those experiences. You know, for clients, we were researching the digital front door. We were looking at opportunities to mitigate some of this patient churn to these category disruptors. And we were helping our clients really identify opportunities. And so what we decided to do was continue to ask this question in our tracker. And over time, we began to see an interesting new story begin to emerge with regards to this question. So now, at this point, what we're seeing is that local hospitals and health systems gained more trust. You know, these are the results of that same question that we were asking pre-pandemic. Now we asked again in April 2020, and these results that you're seeing on this slide are from the July study that were for the purposes of this presentation. And what we now see is that for both digital natives and older generations, they trust their local hospital or health system more than a tech company to provide the best tool to help them find and select healthcare services. So I get it that this is a very specific question. I mean, what we sought to do with this study was to really go deeper into what does this mean and what are the implications for healthcare. And we wondered, you know, to ourselves, if this could really be a strong, relevant, and believable distinguisher for healthcare providers against the tech and retail players. And so the short answer is yes. The question that we asked was, how would you rate your level of trust in the following brands to address your health concerns and needs if they employ healthcare professionals on staff? And so what we see is that this higher trust in hospitals and health systems extends just beyond digital tools. So the good news is they don't yet trust these retail and tech competitors or disruptors in the context of delivering care. You know, if we look at this data, we see that health concerns in general, trusting these competitors to address health concerns in general really falls below 50% for the tech giants. And I'd be curious to know any of your thoughts as to what do you think is behind this? And would love to see any comments that you want to write into the chat area. You know, some of the things that we thought about were experience. Is it really the experience of the healthcare providers? Is it capabilities? And I see some people writing data. And yes, those who put data and privacy concerns, that's one of the biggest factors that is at play here. So let's take a look a bit at that data and the data that we have around that issue. You know, there are major concerns about data security and privacy with major tech firms. Consumers are particularly distrustful of how Google and Amazon would potentially use their data. And the way that we went at this question is we used a tool that we oftentimes use called online metaphor elicitation, or OMET for short. And it's based on the idea that there's two systems at play in our brains. And so this one system that's very logical and rational and language-based, and there's this other system called System 1 that really drives a lot of our perceptions and beliefs and behaviors. It's very emotional and feelings-based. It's kind of those automatic things, those assumptions and beliefs that operate in the background, and it's not a language-based part of the brain. So what we do is we ask people to answer questions with images rather than words. And so what we see in some of this research is that comments like this: I would feel as if by using this app, I am taking a risk with my medical information and being exposed. You know, these companies collect data on me and others So your medical information would not be considered private. They are peering into my privacy. And this third quote, receiving healthcare from a technology company makes me feel cold and uncared for, really goes to the patient experience, which will continue to be something that we need within the industry to focus on in order to drive loyalty and impact churn. Consumers are less concerned about the retailers with trust in more of the mid 50 percentiles in those prior slides that I showed you. And it's probably because they're already in the health and wellness space to some extent. And they have their data via prescription fulfillment. But there's still some concern about the quality of healthcare received from retailers and the idea of additional healthcare outside of prescriptions from these places that still is novel. Now, this first quote, I am not sure of the quality of care I would receive here. It would be dicey. And this third one, the idea of using a retailer like CVS or Walmart is tempting, like cheese in a mousetrap. However, the danger is always there. So there's definitely some concern that is a potential opportunity to capitalize on from traditional healthcare providers. But the real question is, how long is this competitive advantage going to continue? Is this merely a short-term opportunity that's being presented because of the pandemic, or is it something that will linger post getting this virus under control? Even though trust in tech and retail is lower compared to primary hospitals, it's definitely growing with each new generation. And as the novelty wears off and healthcare delivery through these alternative channels becomes the norm, we expect this trust gap to continue to close, especially with younger age cohorts. So I want to look at some varying levels and types of care to further unpack this opportunity. And we're also, in addition to the generational age differences, we're also going to look at some differences by Black, Hispanic, and non-Black, non-Hispanic consumers. So first, we looked at trust to deliver high-quality telemedicine by age cohort. And when broken out by age, we see that millennials have a significantly higher trust in technology companies than when compared to Gen X and boomers, which makes sense because millennials historically have been the quickest to adopt and have just a general comfort level with digital delivery mechanisms. We saw this in their early adoption of Uber and Lyft, with DoorDash, Grubhub, many other examples that we could talk about. So of course it's not a surprise, but what is encouraging is that hospitals and health systems far outpace the technology companies in terms of trust to deliver high quality telemedicine, regardless of age cohort. And this trend carries through to likelihood to use virtual care. While there was a strong increase in adoption for Gen X and boomers, the long play here for the security of the health system is Gen Z and millennials. And winning them over in terms of the customer experience, which includes integration across all healthcare delivery channels, is going to be critical. Telehealth used to be considered second-class care. And yet what we've seen pre-pandemic and continuing on through the pandemic is that satisfaction levels with telehealth, once you experience it, once you get over the hurdle of the technology adoption, are very high. And what we also know is that consumers historically believe that high quality care required an in-person visit or required some level of physical touch. And yet, according to the American Telemedicine Association, 70% of what clinicians need to know to accurately diagnose can be accessed via audio or video alone. And, we also all know in the healthcare industry that telehealth has been a game changer for access to behavioral health services during the pandemic. And honestly, it could be the answer to our access issues that have been chronic for so long. Looking at and thinking about what are the experiences of Black and brown consumers, we see huge differences in trust of healthcare and hospital systems for Black and brown consumers who have demonstrated a distrust of traditional health systems for generations. And I would argue that some of this is probably well-deserved. We haven't always tried to understand their experiences and what's unique about their experiences and what they need. Instead, we've made assumptions based on our what I call whitewashed, data and experiences. In our data, we see that Black and Hispanic Americans, more so than our white Americans across the board, trust retailers and tech companies to address their health concerns and needs if they employ healthcare professionals on staff. So for some of these consumers, I would imagine that there's a sense that anything is better than what exists today, and frankly, they have more experience with tech and retail providers. So they're probably more willing to trust them providing new services, particularly given their history with the healthcare system. And there's just a general understanding that these companies are experts in what they do. So the presumption, I would imagine, is that this can translate over into healthcare as well. So, from our perspective, it's really critical that health systems act now to take advantage of this trust gap. But how do you do that? Some of the areas where immediate traction now would help slow down the entry of retail and tech are telehealth. And again, when I say telehealth, I mean healthcare anywhere other than in person, whether that's a clinic visit or otherwise. Wellness, particularly as it relates to monitoring health data, but also helping to empower consumers in their healthcare journeys. And marketing, how do we change the way that we speak to consumers to capitalize on this trust gap? How can we message to different audiences more effectively and speak to them in their language? Health systems have a leg up. Consumers trust them more to provide in-home care, and health systems and hospitals are definitely seen as the experts. We asked about a comfort level with providing differing degrees of care at home. And overall, what we see is a general comfort level with the idea that most types of care being provided at home, including acceptance of the idea of in-home visits, hospital at home services, and of course, telehealth using video and audio. So let's look at some of that data as well. We talked already about this, and again, it's well documented, the explosion of telemedicine during COVID. And we saw that earlier in the deck, that consumers across generational cohorts are far more accepting of telemedicine post-pandemic in comparison to pre-pandemic. And what's encouraging is that consumers' trust in telemedicine is very strong when it comes to the local hospital or health system. It far outpaces tech companies, solely online telehealth providers, retailers, and other insurance companies. So that's good news. Which makes us wonder, are house calls going to make a comeback? Seriously though, if we really buy into this idea of consumerism, this will require that healthcare be delivered on the consumer's terms, not just giving them more option, but truly on their terms with seamless integration, regardless of the delivery channel, time, type of care, synchronous, asynchronous, all of those things are part of really adopting a consumerism first approach. This trust in the local hospital or health systems extends to receiving in-home visits. What we found in our research is that currently more respondents are comfortable with the idea of receiving at-home in-person visit than they are, that's 72%, than they are with returning to the hospital or clinic for a visit, that's 63%. And clearly this is a COVID-driven response, and this will change when the virus is under control. But that said, we won't go back to where we were in January 2020. There is going to be an expectation for some level of in-home care and the ability for consumers to choose that. And we were curious as to how this comfort extends to more serious conditions, not just general wellness needs. And so, if you look at these categories here, we've asked about comfort level with in-home visits, general wellness needs, routine health conditions, an ongoing non-life-threatening health condition, a chronic health issue, and a more severe condition. And so at the high end of this, 67% of consumers are open to receiving in-home visits, not telehealth, in-home visits for their general wellness needs. And at the low end, if we can call it low, 45% of consumers said they're okay with getting treated at home for a more severe condition. That's a strong number, and actually it's one that surprised us. So given this preference, we may see consumers become more willing to consider in-home care from some of the disruptors that we've been tracking or looking at, especially for either less serious or common conditions, or ones that require higher levels of monitoring or that can get out of hand if not managed correctly, particularly if they beat the health systems and hospitals at the marketing and user experience game. The fact that baby boomers, who currently have the most chronic or heavily monitored health conditions, represent the largest percentage of new virtual visit users isn't surprising. And I'm sure that's in part because they had the lowest technology adoption pre-COVID, in addition to being the heaviest users of healthcare in general. But you add that to the fact that boomers also have the highest trust in receiving care from a hospital rather than another channel. Really, the only way standing in the way of this market, notably the boomers, would be a poor user experience. So if we look at level of comfort with receiving in-home care from healthcare competitors in retail and technology, even though it would be from a healthcare professional, consumers still suggest that they're significantly more comfortable with hospitals and health systems. 72%, as we saw earlier, are comfortable with in-home visits from their primary hospital. 43% from Walgreens and 32% from Google. If you recall the earlier slide, about 10 slides ago, where we asked boomers, Gen X, and millennials if they trust technology providers to deliver high-quality telemedicine, we saw then that 20% of millennials and 14% of Gen Xers would trust a tech company. So when combined, this is probably roughly the same percentage that's open to receiving in-home care from Google. If health systems do not create more virtual care experiences that rival that of tech and retail, we're going to be left behind as other industries supply that growing demand. As a reminder, adoption of these telehealth alternatives is really higher currently out of necessity, but the barriers to use that existed before are still there, most of which are centered around accessibility, knowing when and how to use it, ease of use, and then integration. On the other hand, there's a greater awareness, a willingness, a comfort with virtual care on the part of consumers than has ever existed. And hospitals and healthcare providers have earned the trust of consumers during this very difficult time that we found ourselves in 2020. So given that this pandemic isn't going to go away anytime soon, consumers are going to increasingly rely on virtual to receive care. And I don't think any of us know exactly what the end game looks like, but we can count on the fact that we're never going back to where we were in January and February of 20. So it's really now is the time for healthcare providers to step up. So leveraging some of those technology companies for what they do best in creating great user experiences, and maybe even considering partnerships where both win, would just be one way to maintain the market share and steal back the millennials and Gen Xers that we are losing at the digital front door. And certainly there are many other models to consider. For those with chronic conditions, there's a little more trust or openness to technology coming from other sources, specifically around this issue of home monitoring. And this is probably one of the bigger threats right now, as we've seen past entrants into the market via technology. If you think about outside of healthcare, DoorDash is known for its restaurant delivery service, but it's also become the back-end technology for many grocery chains, which is really presenting a threat to Instacart. And we're all comfortable with Apple Watches providing biometric data. So it would be an easy jump for consumers to make to home monitoring. And so if we're not careful, this will be their entree into healthcare. We've seen, in various parts of this presentation that both younger and Black and brown consumers have higher levels of trust in the tech and retail providers. And these groups are going to become more dominant, and they're going to gain more purchasing power. In fact, Gen Z is the most ethnically and racially diverse age cohort ever. Nearly half, 48%, come from communities of color and are the future users of healthcare. In fact, Gen Z is the last age cohort that's predicted to be more white than non-white. So Black, Hispanic, Black, brown, communities of color. We have several clients in healthcare and health insurance that are actively studying Gen Z to understand how can they adapt to the changing expectations of this group and to ensure that they stay relevant as this group comes of age and begins to buy healthcare. And this is something that we should all be thinking about and we should all be actively pursuing. While comfort with in-home care from a primary hospital is still the biggest category across racial and ethnic groups, we see that Black and Hispanic consumers are far more trusting of retail and technology to deliver in-home care, in contrast to some of their non-Black, non-Hispanic counterparts. And again, we believe that this is in part because they have more familiarity with and experience with these companies than they do with healthcare providers. And those experiences just may have been better than what they've received from traditional healthcare providers in the past. There's some other research on this topic that we're following that has found that white consumers are significantly more likely than Hispanic and Black consumers to say the following happened during the last time they visited their doctor. One, they were comfortable with their doctor. Two, the doctor explained things to them in an easy to understand way. And third, the doctor answered all of their questions. And we know from research that there's a significant difference in confidence levels as it relates to these different cultural and ethnic groups as it relates to receiving quality treatment for COVID. 37% of white consumers in our research, 30% of Hispanic consumers, and 25% of Black consumers are confident that they would receive high quality treatment for COVID. That's an alarming statistic, for a number of reasons, but it's something that we need to be aware of. And in fact, what we see is that Black and Hispanic consumers are more open to the idea of hospital at home services than non-Black or non-Hispanic consumers. 55% of Black Americans say they're open to the idea of hospital at home. 60% of Hispanic consumers and 47% of non-Black and non-Hispanic consumers. And while there's a mistrust and maybe it's a lack of exposure or maybe there's a circular relationship between the two, this seems to be suggesting that any new option is potentially better than what currently exists and is worth exploring. So I want to turn this over to Stephanie to talk about what are some of the marketing implications, but I want to close my comments by saying that consumers have caught up. We are now seeing that 83% of consumers agree that telehealth can replace some or all of their in-person care. And we're also seeing that many of them, as much as a third of them, are more likely to choose a provider that can deliver telehealth, if given all things being equal. So they're saying, I'm going to select a healthcare provider based on their ability to give me the choice, whether I want telehealth or in-person. So if we in healthcare don't seize this moment and confront this inevitable shift and embrace the trust that consumers are placing in us and really make it easy for consumers to access care in any manner that they want, we will ultimately lose them to more tech savvy and marketing savvy competitors. So Stephanie, I'm turning it over to you.
Thanks, Sandra. Yeah, after that review of the data and the implications for marketing, I don't think will be surprising at all. First of all, we need to not simply take our marketing and communications materials and put in people of color. We need different and distinct marketing efforts for Hispanic and Black Americans. Now look, I worked at an agency for the better part of 10 years and I know how it works. It starts with the clients looking for a quick fix to get a version of creative out of the door that is more diverse or representative of specific audience. And often the agency is rushing to meet a deadline. They insert token United Colors of Benetton type stock photos, and there you have it. Everybody's happy. And while well-meaning, that's definitely not enough anymore. It never was. We need to understand their experiences and how to create marketing efforts that are tailored to that experience. The creative brief for Hispanic or Black Americans is different in healthcare. You know, one of my clients was a large Fortune 500 company, and they had a separate Hispanic marketing agency altogether. And that agency didn't just translate the mass media campaign that we had created into Spanish. They created a unique campaign that incorporated the differences in values and lifestyle of the Hispanic market. We need to consider this for healthcare for people of color. Now, of course, at MDRG, we believe it starts with consumer insights, testing messages to see if they're hitting the mark with the audience you're looking to reach. And some of our more forward-thinking clients across industries are already doing this research. They're well ahead. Now, the second critical thing that we're seeing here for marketers and communication teams to think about is how can we nurture trust in a skeptical audience? We know from our own research that 27% of Black Americans say they will never get the COVID-19 vaccine. This is a result of this lack of trust stemming from historic and structural racism. Now, aside from that data point, we have plenty of evidence pointing to the validity of this distrust, from the Tuskegee study to recent studies measuring implicit bias of interracial doctor-patient relationships. Which brings us to the second point of working harder to instill trust via community outreach. Now, Sandra spoke to a hypothesis regarding people of color's higher level of trust in retail, that being in the community, a familiar use occasion, a positive experience instills a level of trust. If that hypothesis is true, then a presence in minority communities is critical. How can we better integrate into their lives so that they are familiar with us and they trust the care we're providing? How can they see us every day? How can we be a part of their, daily life, their daily routine, in order to build that trust? We need to integrate into their lives so that they're familiar with you and trust the care that we're providing. How could we be more visible in their community? What can marketing and communications do to bring the organization's message to these audiences? Just as we deliver care, how, when, and where the consumer wants it, we need to deliver our message in the same way. What is that message? Well, let's look even more specifically and tactically at what marketing can influence in order to capitalize on this trust gap right now. As Sandra discussed previously, there are two major concerns related to the entry of tech and retail into healthcare: quality and continuity of care, and privacy, data privacy. Tech and retail can't compete on quality. They can't compete with the institutional knowledge and expertise that healthcare has. Further, there's a major concern of data privacy. I know that I saw in the news in July with some of the riots that were going on, there was a Walmart and a Walgreens that had gotten broken into through the riots, and there was a breach of privacy. So a lot of patient data had been exposed and at risk. We don't see this happening at hospitals. And consumers don't want to give big companies, particularly tech companies, more of their data, not to mention health data. And what some of them may not put together, and that Sandra kind of mentioned, is that Apple Health and Google already have a hand in the game already with wearables and heart rate monitoring and sleep tracking and the like. But consumers don't want to release that full picture yet. They're more interested in wellness than ever. They're not quite ready to go that extra mile to give these tech companies all of that information to make the types of recommendations that their doctor or primary care provider could. So healthcare needs to offer the full picture first and offer it with a great experience. In the meantime, we need to work to expand the trust gap and message data privacy and expertise over and over. And overall, healthcare systems have consumers' trust. We've seen that, the data proves it, but it could fade as other industries enter the market. And why would it fade? Well, like we said, these disruptors may not have healthcare expertise, but they certainly have customer experience expertise, particularly when it comes to digital delivery. They also move faster. So it's critical that as adoption accelerates, so does your focus and iterative approach to experience optimization. Whether it be the ill-branded waiting room, I mean, come on, that screams bad experience. Or scheduling an appointment online, every step needs to be seamless and intuitive. This is the expectation of Gen Z. Integration across platforms, devices, wearables, and voice technology. Ultimately, customer experience is going to drive success or failure here. So we need to mind the gap. Looking at our trust gap again, yes, we are winning now, but not by much. This gap will continue to close as consumers become more comfortable with retail and technology, and even telecom providers enter this very lucrative space. Healthcare providers can seize this moment in time to say, you can trust us. We've been on the front line for you. We've demonstrated that we have the tools and the expertise. We've demonstrated that we do what we say we will do. All building blocks of trust, which is the most important driver of connection with brands. Connection that drives purchase consideration and ultimately usage. So with that, we'd like to thank you guys for attending our webinar. We would love to give you guys some homework and to email us. This is Sandra's email, sbrown@mdrginc.com, to discuss the implications of this for your organization, how you can use your existing research to maybe cut the data in different ways to see how you can influence your marketing strategies, or to give this presentation to an internal audience. We're here to help, and we're happy to be a part of those conversations with you and your team as we kind of continue through this new time in healthcare. We will be emailing this presentation out, the video as well as a copy of the presentation itself. So that will come either end of day today or tomorrow. So keep an eye out. Thank you, everyone.
Thank you.